My name is Julia Mader. I'm a physician based in Graz, Austria, working at the Medical University of Graz. My main research focus is diabetes technology, both in the field of type 1 diabetes and type 2 diabetes. And the focus in the field of type 2 diabetes is to develop algorithms for safe insulin delivery in the hospital. So I think currently we see less hypoglycemia than you would expect in type 2 diabetes, which is sometimes attributable that we do not measure enough. And I think when then the patient gets a device where he can or she can measure the glucose, then we get higher hypoglycemia rates than we previously knew when patients were just performing SMBG measurements. And also, as we have changed now to more modern insulins, it's also a burden that is less pronounced. But of course, I have to say that I'm seeing a subset of patients that are treated at the university level, where they are or do have access to the better and more stable insulins. When we see patients who are treated in the outpatient setting by a GP or by a general internal medicine physician, they are very often still on premixed insulins, and those patients experience way much higher rates of hypoglycemia. So in type 2 diabetes, the issue is probably less pronounced than in type 1 diabetes, but still there are patients, especially with longer duration of disease, when they do not have a residual insulin secretion, that they then go on a more intensive insulin therapy regimen, and then they are more prone to hypoglycemia. So one of the big issues, in my opinion, is that patients need better education about how to adjust their insulin therapy. For example, that if they are not eating carbs, they need to decrease also their premixed insulin dose, or if they are exercising, that they also need to take that into account, and not only in the first or second injection, but maybe for the whole 24 hours following exercise. And in a sense, it is lack of knowledge also in the area of the physicians and the educators who should train them, kind of to bring that knowledge forward to the patient. Additionally, of course, patients still are not so much on technology as type 1 diabetics are, so they are kind of also suffering with a lack of available technology to them. It is getting a little bit better, but still only a few patients are equipped with flash glucose monitoring. It is not the access because it would be funded by the state, but it is kind of a lack in knowledge by the treating physicians and educators to switch them to more modern products, as they are themselves not very familiar with them. So it depends where the patient is treated, whether he is treated at a university center versus somewhere out in the field. Those patients who are treated by a GP, maybe on the countryside, they in most cases do not have the same access to medication and monitoring devices or pumps as in a center.